Hello and welcome to episode 20 of the Rogue Health Economist. We are talking transformational change of the healthcare system this week, and I'm super honored to have as my guest for this episode, Christy Mack. For those of you who are not familiar, Christy has been sort of doing incredible pioneering work to bring integrated medicine to the forefront through the Bravewell Collaborative and through many other organizations like Duke and what was happening down there. And so we're going to jump in a little bit to that today and to talk about a new campaign that I think has the potential to really engage a lot of people into health creation. So welcome to the show, Christy. Thanks for being here.
Thank you, James, for having me. It's glad to be here.
So first things first, for those people who aren't as familiar with your body of work, how did you develop this passion for integrated medicine, and what have you been up to?
Well, I grew up in the South, and my father was a general surgeon, and he took care of patients who didn't have insurance, and he saw a lot of them in his home. And it was basically a factory town. And one day a fellow came into our home, and his little finger was dangling by just a tendon. So my dad sewed him up, took him into his office, and chatted with him, sat him down, and said, "So, Ed, tell me what you were thinking that you allowed this machine to nearly cut your finger off." And there was dead silence, James. And he said, "I'm serious. The machine did not do this. You did. You lost focus. And we need to find out what's going on in your life, because this can't happen again. You need this job. Tell me about your marriage. Tell me about your children. What sort of stresses are you under? What do you do to relax?" And that's how I saw my dad practice medicine all my life. And it wasn't until I got married and entered the real world of healthcare that I realized it was sorely lacking. And then when my kids left home, I said, what am I going to do with my life? What's my tagline? And I heard Andy Weil on television on PBS. And I went, oh my Lord, this really resonates with me. And there were a lot of reasons why I was focusing on it at the time. But I chatted with Andy. I called because we had given money to PBS. And that's how I got involved in what they call then integrative medicine. And so in 2000, I co-founded and served as president for the last 13 of its 15 years, called a collaborative called Bravewell, which Ford Foundation studied as one of the most excellent forms of philanthropic collaboration in healthcare. And we decided when we were forming that we were going to try to figure out how we could fast track integrative medicine into mainstream medicine. And there were 4 academic medical centers meeting at the time when a bunch of philanthropists got together and met with these physicians out in Miraval in Arizona. And we spent a weekend talking about that issue. And out of that came Bravewell, because it takes courage to stay well and to get well. It was a 501c3 of philanthropists around the country. And we decided to partner with the very system we wanted to change. And those were the docs. And in 13 or 15 years that it took us to do this, we were amazingly successful. By the time we shut our doors in 2015, that group had grown from 4 to 76 academic medical centers around the country. And we partnered and funded with the Institute of Medicine the first ever summit on integrative medicine and the health of the public, the most widely attended, the most publicized summit ever in the history of the IOM. After that, we thought that perhaps we were done. Our goal when we were created was to not exist, which kept us focused on these narrow roads. And because we didn't have the resources and we didn't have the staffing or the wherewithal to do it forever. Yeah. And it was really a genius thing. So after Bravewell, we shut our doors in 2015, I realized I wasn't done, that we did a great job working with the system we wanted to change, but now I felt it was time to reach out to the public, and specifically the underserved. So there are no galas, no big red, no red dresses, no pins, no buttons, no brouhaha. Just a quiet campaign, what we really want to call a movement. And it's called Take Care. We say it all the time to people that we don't even know. And I think over time, we've lost the intention behind those words, both in the receiving end as well as on the giving end. And our goal is to reignite that. So I put together another philanthropic collaborative called the Healthy Us Collaborative. And that is set up as a 501c3 to fund the Take Care campaign/movement.
Beautiful. Well, before we get into the details of that movement, on Friday, I've got to have Dr. David Katz here on the show. And
tell him hello.
I think he's been a great thinker on this. In one of his interviews, he shared that what we need is a nationwide Get Healthy campaign because of the sort of lack of resilience in the system, and also sort of the prevalence of lifestyle-driven chronic disease that's making us uniquely fragile in this moment of the stressor like COVID-19. When you emailed me and shared me what you were doing, it seemed like you had seen the same way, and perhaps that this could be that.
Yeah, we're hoping it is, because what our intention is to create materials, products, and resources for people to go and use in their communities. The goal here is to create what we're doing is very different. This campaign is done through storytelling, and we are producing 40 plus independent film shorts by award-winning independent filmmakers. And the idea is to capture the most prevalent and yet preventive chronic health care issues that we're facing as a nation. We use the healthcare issue as the door to begin the film, but it's not about the issue. So in other words, it's not about the Iraqi vet who has a blown out knee. It's about the fact that his life is a mess. His romantic life, his career, and his personal life and his health are a shambles. There are a lot of the people who can relate to that. They don't have a blown out knee, but they can relate to that. So these are characters that we're pulling out of society. Nothing is scripted. It's all beautifully filmed. All the music is original, and they range from anywhere between 4 and 8 minutes long. And the idea is for the viewer to experience something transformational in the film that they can relate to the character. And I'm really so surprised and so grateful for the intuitive, introspective comments that these characters come up with on their own. They are beautiful moments in these films. And I urge anybody watching this to go on to the take5.org site and take a look at the 5 films that we've put together that specifically relate to the COVID.
Well, let me pull this up on the screen here, Christy, so we can show people. So this is a little bit of a detail here about the Healthy US Take Care campaign. So take us through these films. We got 1, Stress Reset, Just Breathe, Night After Night, Cooking for Life, Nature, No App Required. Why did you choose these topics?
Well, Ariana Huffington, we're appearing on her Thrive Global site as well. So she had come out with a blog that suggested 5 things you could do while you're socially isolated. And we felt that these films spoke to those issues. And in Find Your Reset, these are adults and children from all walks of life who talk about the ways, what do they do that, what happens in their lives that causes stress, and what have they found to do, easy, simple tools they've incorporated into their lives to reduce that stress. In Just Breathe, it's about the California fires in Santa Rosa, California. Oh, yeah. But it's not about the fires. It's about your life being turned upside down by something that's out of your control. And this is of a little 3-year-old girl who learns breathing tools. And at the end, the father says, "Who are you and what have you done with my daughter?" It's fantastic. And he says that the breathing techniques that she is learning and they are learning together has brought them together as a family. And as a community, they're making their lives over again. Night After Night is about a woman who's never, ever had a full night of sleep. And she's just discovering the simple little tools in her life that she can use to incorporate it. She's not fully healed, but she's living a much better life than she did before. In Cooking for Life, these are 2 women. One is a student, a junior, I think she's in the 7th grade, and the other one is a medical student, and how they come together and discover the importance of nutrition in their lives. And her mother is a sanitation worker outside Chicago. This is a beautiful film, and the seventh grader says, "My favorite section is the produce section." I don't know of any seventh graders who would say that freely. It's just a great film. Nature, No App Required is a 15-year-old girl. She feels like she's getting a heart attack and she's getting migraine headaches, and the doctor prescribes nature. So she's supposed to go out in her hammock in her backyard 1 hour a week. And she says she's discovered that clouds move. She never believed it when people said clouds move. But it wasn't until she did this quiet time and just be with no outside influences or interactions whatsoever. And she's now taking her younger siblings out in nature, and she's recommending to her friends that they do the same.
Amazing.
So this is an opportunity for this movement to meet people where they are in their lives, and to take from these films, along with all of the other tools that we're creating for these films, to have a conversation around them. What relates to you? And the campaign is designed around the premise that everyone, no matter your walk in life, has a great why. Why in your heart of your hearts do you really want health and a sense of well-being? Everybody has one. And then, but we're also dealing with the great whats in our lives, those obstacles that are standing in the way of our realizing and achieving those great whys. And the movement is designed to offer the great hows, simple tools they can incorporate in their lives that are easy, accessible, free, and daily. And we do that through the Did You Knows. And instead of telling people what to do, that's not our intent. And our intent is not to empower people. Our intent is to show them they already have the power, and these tools are there to help them enhance the power they already have to take care. A simple did you know would be, did you know that every time you're kind to someone, you feel healthier, you get healthier? These are all data-driven. We have 45 healthcare providers as our advisors on our films and on the Did You Knows, so that everything we're presenting is data-driven.
Beautiful. Well, just to look at some of these, the ways to do it, you can get these, you can go to, well, the first thing to do if you're interested is go to takecare.org/take5. You can register there and you can get all this information. You know, I think what, obviously putting on events online with social media, doing Facebook watch parties, discussing these film shorts, discussing whole health and some of these calls to action. You know, one of the things this reminds me of, so I don't know if you know this actually, I'm not sure if I ever told you, but in 2015, we did the Evolution of Medicine Film Festival where we had integrative doctors put on showings of Escape Fire. And I know you get involved with that. And I felt like some of what you were saying there was some real resonance in that film because, you know, you have a filmmaker who really knows what they're doing. They know how to like really bring out emotion to make you feel like, yeah, we've got to do things differently. And I can't remember meeting one person who didn't watch that film and think, oh, I want to see a different type of practitioner or I want to do my health differently.
Yeah.
I guess what it seems like this is sort of like more bite-sized chunks that could end up taking people in the same direction, right?
Yeah, I was an advisor on Escape Fire, and I called Matt Heineman when I thought of this project, and I said, Matt, we need to do another PBS special. And then Mr. Trump entered the campaign. And we were already talking to some independent filmmakers about doing a PBS special. And I said, stop. This is all about social media. We're going to have to flip everything we were thinking of doing and go the social media route. And so that's how all of this started to get developed. And we always knew that we would somehow be online. We also have a health reflection tool. And I experienced something like that. I built a 27,000 square foot facility at Duke for integrative medicine. And I thought I better go through the program because people are going to ask me what I think.
Yeah.
So when I did, I had this health reflection questionnaire. And the very first question was, do you like where you live? I don't know of a healthcare professional that's ever asked me that, ever. And I said on a scale of 1 to 10, I had to put a something. And so I put down a 2. And I said, I'm wondering what living in a tube for 30 years has done to me mentally, emotionally, physically, spiritually, and in community. And then the next question was, where would you like it to be in 2 weeks' time? And James, do you understand how the conversation has now changed? Where do you want it to be in 2 weeks' time? So suddenly I'm in control, and I have to come up with a solution. So I sat there and I said, 2.5. And the next question was, what do you need to do in your life to move it that step? Oh, I said, are you kidding me? I don't have control over this. We live here. It is what it is. My husband works here. That's it. So I thought and thought and thought. And I said, well, maybe if I just put a flower on my desk every day. Simple, easy. The next question was, who and what do you need in your life to help you do that? And I said, well, I need a garden, or I need a florist, or I need to just pick up a flower, a stray flower I see on the way. And that is how I went through my entire life. And I came up with the things that I thought I could do. There was ownership. I believed in it. And I became a real participant in my own health.
Yeah.
We have simplified that a lot for this movement, but we're tweaking things a lot. And we have a new social media group now. We've got a new website group because of COVID that we've decided we really need to move this forward in a big way. The test markets we've been doing in Sacramento, Tucson, Nassau, Nashville, Omaha, and Milwaukee, and East Harlem. We got through Sacramento, Tucson, Nashville, and Omaha before COVID. And we were entering East Harlem, and Milwaukee, they had to wait because of the Republican National Convention. What we found out was Duke really took this on, even though they weren't our test market. And they want to be healthy Duke, healthy Durham, but they also want to be the first healthy take care state. So we are hoping that through the social media, we can log on to this and grab it, because I do believe things are going to change, and the new normal will probably be better than it ever was, because I do believe social media and being able to reach out to people on a national level is the way to go.
Beautiful. Well, look, for people who are watching, ultimately, what is sort of like the different layers of participation that they can have? I mean, ultimately, there's a lot of people out there that care about these same kind of things. There are community organizers. I mean, I definitely resonate with the group piece, just because I see that, ultimately we need to take this away from like the professionals and really bring it into groups of people holding each other accountable to implement these kind of changes. And I just, I wonder what are some of the partnerships or those kind of things that would be possible to really push this forward.
Yeah. Well, the American Heart Association is partnering with us. We have some others as well. I've gotten some great funding from people. Obviously, these films are really, really expensive. The funding is big, but basically we are looking for grassroots buy-in, philosophical support, where you understand the concept, you log on to it, you get it, and you want to spread it in your communities. So we're hoping that this COVID opportunity gives people a chance to go online and create an internet film fair, a virtual film fair. We will have curriculum guides, we have the viewing guides for the films to take people through how can we create a conversation around this. I think the real missing piece in any of this nationwide effort, James, and I think you'll agree with me, is the health coach. Yeah. You need somebody there one-on-one or 1-on-30, because it can be done online. But there has to be a person who understands whole person health and well-being, and the interaction of the mind, the body, the spirit, and the community, and how that affects a person's health. People think they understand spirit, and they think maybe it's religion. But for us, for Bravewell, it's the answer to 2 questions. Where do you go for strength in a time of crisis? And where do you go for strength just to get through your day? That's important for a provider to know. And more importantly, it's critical for the person to know what that is. And it could very well be your God. It could be nature, poetry, art, a spouse, getting lost in the noise of the traffic going by on your stoop in the Bronx. but it's important to know what that is. And by community, you can be a community of one living with a parakeet, or you can be in a community of 1,000,000. Basically, how you treat yourself and feel about yourself and how you treat others and others you has a direct correlation on your ability to stay well and to get well. And those are all the components that we're trying to put together so that people understand how important everything that happens in their life affects their health and their sense of well-being. And that's what this movement is trying to do. And that's what we hope to accomplish.
Yeah.
But the health coach is the critical piece, having those community representatives where people can reach out and say, I need help, or I want to do this simple thing. How can I make sure I do it?
I completely agree with you. So much so that actually the plans that I have as a health economist to bend the curve all revolve around these health coaches. And I do see this need of almost like a pre-primary care layer, right?
Yeah.
Because ultimately, you know, and one of the things that I've seen is many of these health coaches not only know what to do, but have actually been there before. Because why do you become a health coach? It's because you overcome, you know, a chronic condition yourself. And I feel like there's almost like this peer-to-peer dynamic that's really valuable to say, look, this is what I did. This is how you can do the same thing. And I believe that that is the missing piece in medicine. And we are working to, you know, to reestablish that order. And one of the things that I'm excited about with COVID is that, not excited about is maybe the wrong word, but, you know, just think about in medicine, what order of care you would have to get to a health coach. It's like you go to the first doctor, he sends you to a specialist. That's the wrong specialist, another specialist. Then you try another doctor, another specialist. Then eventually you go to a functional medicine doctor and they might recommend a health coach to help you. And it's like 8 people got in the way. All you actually needed was a health coach. And
Absolutely.
for like disintermediation, where it's
Yeah.
like all the middlemen out the way. Here's someone who's inexpensive, who's in my area. If we do it in a group, it could cost almost nothing.
Yeah.
We could be like building our health together. That disintermediation, I think, is something that's exciting about today, because not only are functional and integrated medicine clinics out of business, but primary care and family medicine is largely out of business, and people can go directly to the source. And so I think there's a great opportunity now to help people find these kind of coaches and empower
That is happening. And that is happening.
Yeah.
Duke has been training health coaches for integrative health coaches for 4 years. 5, actually, no, longer than that, thousands of them. And they've just gotten together with all the other integrative health coach programs around the country. And they have just accomplished the first step for certification for that position. Look at what the PA is doing now. Duke created the National Certification Program for the PA. The stuff they can do, they can prescribe medicines. I have a nephew who's a PA in the Marines, and he's doing bariatric surgery. It's unbelievable, and it's all reimbursable. So the health coach is coming along. The VA has taken the executive director at my facility at Duke was hired away by the VA to be the executive director for the special division they created for patient-centered care and cultural transformation for the entire VA. She has created a peer-to-peer mentoring program, health coaches, for the veterans, because the veterans go through the program, and just as you said, they want to help. They can just be people who want to be of service to another human being. They can be divinity students, nursing students. They can be retired professionals who want to have a purpose in their life again. So we believe that if we can get a national program going where this can be reimbursable by insurance, we're off and running, and that issue will not exist anymore. So we've got to get it out there and create, again, proof of concept that this person, this position is the missing link between the patient and the major healthcare provider.
Absolutely.
No question.
I mean, obviously one of the most exciting projects in my world has been this Functioning for Life project at the Cleveland Clinic,
Sure.
which is PAs, dietitians, and health coaches working together. And
Absolutely.
one of the most exciting things is that, you know, how long does it take to become a great integrated doctor? It's like a decade of study and all these things. These people were getting results in 10 weeks because there was
Yes.
a specific program that was executed, and they just had to like paint by numbers. And
Yep.
I feel like we need that to scale up the effort. And so I'm right with you there.
Yeah.
Well, look,
Well, I know Andy Weil started a program for integrative medicine out there for physicians to become fellows. But then we realized there was this missing link, and I think it's the most critical missing link in changing healthcare today. No question.
Yeah, absolutely. Well, let's just finish on that, I guess, is that, you know, we're here, it's what, May 2020. You've been at this a long time. I feel like I've been at this a long time. And I know there's a lot of other people who feel like, you know, change just feels like it's almost there. And there's, you know, and ultimately it feels like maybe the inertia that had kept us where we have been has been broken somewhat by COVID. And I would love to just get your final thoughts on, you know, what your hopes are for this next decade, for example, as what you think is possible if we all pull together in a way that maybe that we've pulled together in this time of crisis.
Well, you know, it's interesting, James, because I think we had that chance at 9/11 to come to grips with who we really are. And we call ourselves human beings, but I don't believe that. I believe we are spirit beings housed in these human doing bodies. And until we accept that we are in the divine and the divine is in us, we will go back to our old ways. I'm hoping that COVID has changed the mindsets of humanity because it's more of an international, it's a global issue. It's not like 9/11 that was isolated in several parts of the country. So that's my hope, because I don't think we can't do compassion unless we are compassionate. We can't do care unless we are caring. And those are the spirit beings within us. And we need to own that. There's nothing vulnerable about it. There's a lot of strength in that. And that is what I think will connect us in more ways than we ever thought possible. And it's that connection that we as humanity desperately need. And that's what COVID, I think, has taught us all.
Beautiful. Oh, well said. And I think one of the pieces that I recognize in why I chose to spend my time doing this is that, you know, we all come across sort of like a moment of pain where we can choose to take a different approach. And I think, you know, what integrated medicine opens up to people is an opportunity to sort of really step into that new reality, which is them as a sovereign divine being and taking care of their health in, you know, in that context.
In that context, yeah. Yeah. And it can be threatening, you know, because to change your beliefs it is very threatening. And you have to do that, I think, in a lot of ways in order to change your behavior. But there are a lot of transformational moments that happen on that journey that strengthen so many aspects of who we really are, that it's worth the journey.
Beautiful. Well, thank you very much for being here today. It's been a great pleasure to reconnect. For those of you who are watching, go to takecare.org/take5. Tomorrow, I'm going to be interviewing someone who is running for Senate on a platform of healthcare transformation in Idaho. And on Friday, we're going to be speaking to Dr. David Katz, who has been on the forefront of talking about a concept called total harm minimization, which I think is a very important concept for understand. And I think, you know, Dr. Katz is equally concerned as many of us are, like what you shared there, is that there are social determinants of health that drive health outcomes, and many of those have become, you know, sideways since the beginning of COVID. Thank you so much for being here on the show. We'll see all of you tomorrow, same time, same place. In the meantime, this has been the Rogue Health Economist podcast, and we'll see you next time.